Hello everyone, we're back. Dr. Cosmos Leigh, Dr. Chris Werness. Earlier we discussed with you our comprehensive postural rehabilitation program. Now what we're going to do is we're going to show you some of the tools that we use to help people improve their posture, pieces to the puzzle, so to speak. The first one here is a halo.
So a halo is a weighted cervical weight. And what we find is so many of our patients are coming in with what we call the flexed posture. So the flexed posture means that the head weight has been put in such a position that it's literally wearing out the neck. And so as you see Dr. Leigh, this is a device that we can prescribe for a patient. They'll typically wear this for 20 minutes when they're at home. We have a lot of patients who actually wear them at work. But what it does is it helps take that pressure off of the cervical muscles in the neck, and it helps redistribute the weight back. So here's the head going too far forward. Dr. Leigh's demonstrating a device that we can use in addition to our mirror image adjustments, and we'll talk about that as well, that actually help to reposition the head back. Okay? Many of our patients who come in, if you'll look at an x-ray, we'll see that their head's here, this is their neck, and they really don't have a curve in their neck. So there should be a C-shape curvature like you see with the muscles, but the bones here are configured straight. We see that all the time. So one of the devices that we recommend is the dinner roll. And the dinner roll is what we call a passive exercise, where the patient will actually stick this behind their neck and they'll lay on the floor, and they can do that for 20 minutes as well. But the key is really to try to reestablish the bones, the ligaments, and the muscles going in a more curved position. Remember, the curve is what takes the weight of your head and distributes it evenly through your spine. One of the other devices that we use is an IntelliSkin. So we've got a couple of varieties in both male and female. And what we see with IntelliSkin is this is trying to aid folks who are in what's called a hunching posture or a flex posture. We can have patients who will wear these under their work outfit so they can wear it up to 8 hours a day. Usually we'll break them in a little bit slower than that. But the idea is that they can proprioceptively start opening up their body, which will help them to breathe better. It will take all kinds of pressure off of the muscles in their spine. And they'll just start to feel better. They'll start standing up straighter. And when we combine that with mirror image adjustments, patients do so much better. What we also teach are what are called workstation ergonomics. The goal in workstation ergonomics is to try to reverse this poor posture. What you need to know is folks are coming in with what are called computer comas or digital dementia, and even kids have technology trance. And what's happening is they're staring at that computer or their phone all day long, and it affects your brain. It affects your brain because it starts to take a toll on the cranial nerves, which control your cardinal gazes. So when people aren't really exercising their eyes, it tends to weaken their eyes, and it has an effect on their brain, which makes them even want to go into that forward posture even more. So it's really important here that at Leigh Brain and Spine, we focus on the brain as well. And we'll do that through these mirror image adjustments. And here's an example. If a patient comes in and they're tilting one way, I'm being really simple about this, then we will put them in the opposite position. We'll adjust them that way, telling their brain about it, and then their brain will do what's called a righting reflex. So your brain always wants to take pressure off of your spine. Chiropractic adjustments are an incredibly powerful way to do that, but it's something also that over time it will affect your brain in a very productive way. There are all kinds of other tools that we use in our ergonomic kit. One of the other ones is an orthotic. So every time your foot hits the floor, you're actually either making yourself straighter or you're making yourself more crooked. We have a custom made cast that we can actually fit and create an orthotic that goes in a patient's shoes. and they'll wear them in both shoes and they'll wear them around, and they will start to notice that they'll have the ability to stand up straighter. So we use every tool we can find in our ergonomic package and in our postural rehabilitation program. The goal is to affect everything: your brain, your muscles, your ligaments, your discs, your nerves, everything to get you to communicate in a way where you're standing up straighter. A wonderful tool that we also use, these are TheraBands. And for example, we were talking about this posture where people are just going way too far forward. Well, what's happening here is the muscles in the neck and the shoulders are all spasming now, and all the muscles in the chest and in the front of the shoulder are getting weaker. So we'll teach really simple exercises that patients can do at home. Here's one that will actually work on the shoulders and the chest, where I'm re-engaging those muscles again, and it's actually going to help me to stand up straighter. There's another exercise we do where we're helping those muscles to get engaged. And interestingly enough, when your muscles get stronger in the front, guess what? Your muscles in the back will actually start to release and relax. So another tool that we use is called a wobble cushion. What we find is a lot of patients aren't standing up straight because their hips are tilted and twisted. When you're not standing up straight, it puts a lot of pressure on those joints. So a wobble cushion is something many patients will use at work or at home. And what they'll do is they'll sit on the cushion, and we teach them to rotate and get that range of motion back normal. Your hips are meant to move. So we just want you to get to move in the right positions so that it aids your body's ability to stand up straighter. And we've had great success with the wobble cushion. This is probably one of the most interesting devices that I've seen. These are called Vox socks. And as I mentioned before, we're talking to your brain, and we're going to find as many ways at Leigh Brain and Spine to talk to your brain. And one of them is wearing these socks, and you put them on, you wear them around like any other pair of socks, but it stimulates your central nervous system. So patients will report back that they have more energy, they're alert, they're more productive, they're stimulating their nervous system. And when we combine that with teaching people how to stand up straighter, the results are impressive. Those are the tools that I wanted to incorporate that we have here at Leigh Brain and Spine. The goal for our patients is they move better, they live better, and they feel better. And our goal is the more your posture improves, the better you're going to do.